All right, ready to dive deep into something we all experience every second of every day,
Mm-hmm.
your heartbeat.
Yeah.
More specifically, we're exploring those moments when your heart's rhythm gets a little offbeat.
Okay.
We're talking cardiac arrhythmias.
All right.
We've got a fascinating excerpt from a medical surgical nursing textbook as our guide,
Mm-hmm.
and I'm joined by our expert to break down this complex topic.
It's amazing how this electrical system keeps everything in sync.
It really is. But before we get into what happens when things go wrong,
Right.
let's start with the basics. How does this electrical symphony actually work when everything's running smoothly?
Well, imagine your heart as a grand orchestra with different sections playing their parts in perfect harmony.
Okay.
You've got the SA node, which is like the first violinist setting the tempo. It's the heart's natural pacemaker.
Right.
Then the impulse travels to the AV node, acting like the conductor,
Hmm.
controlling the speed and making sure everything stays in sync.
So it's like a relay race, passing the signal from the SA node to the AV node.
Yes. Then it moves down to the bundle of His, which splits into the right and left bundle branches,
Mm-hmm.
carrying the signal to the ventricles and making them contract. And finally, the Purkinje fibers spread the electrical impulse
Wow.
throughout the muscular walls of the ventricles.
Wow, it's like a perfectly choreographed dance happening in a fraction of a second.
It is.
And I remember from our nursing textbook that it all comes down to these nodes, right?
It's all about those nodes. That's exactly what the textbook says.
Yeah.
And what's fascinating is that we can actually see this electrical symphony playing out on an EKG.
Ah, yes, the squiggly lines that can seem so mysterious.
But they tell a story once you know how to read them. Each wave and interval
Right.
corresponds to a specific event in the heart's electrical cycle.
Okay.
The P wave shows the atria contracting, the QRS complex represents the ventricles contracting,
Mhm.
and the T wave shows them relaxing, preparing for the next beat.
So the EKG is like a secret code revealing how the heart is functioning.
It is.
And I know from the source material that it's the intervals between these waves
Right.
that can give clues about potential arrhythmias, right?
You got it. For instance, a prolonged QTC interval
Okay.
can be a red flag for potential ventricular arrhythmias,
Right.
which are definitely something you'd want to catch early.
Okay, so now that we have the basics down, let's talk about those times when the rhythm goes offbeat.
Yeah.
What exactly are arrhythmias?
Arrhythmias are simply any deviation from the heart's normal rhythm.
Mm-hmm.
And here's where it gets interesting. They can be completely harmless
Okay.
or a serious medical concern. You know that feeling when your heart skips a beat?
Mm-hmm.
That could be a premature contraction.
Right.
And while often benign, it can sometimes signal an underlying issue.
So how can someone tell the difference between a harmless flutter and something more serious?
That's where understanding the different types of arrhythmias comes in.
Okay.
Our source material breaks them down by location,
Okay.
starting with atrial arrhythmias,
Hmm.
which originate in the atria, the upper chambers of the heart.
Let's start there then. I've heard of atrial fibrillation.
Right.
That sounds pretty serious.
It can be. In atrial fibrillation, the atria quiver chaotically instead of contracting effectively,
Oh, wow.
which can lead to blood clots forming, increasing the risk of stroke.
Oh, okay.
But there are other types of atrial arrhythmias too.
Like,
Yeah.
what are some other examples that people might experience?
Well, you've got sinus bradycardia, which is just a slow heart rate, often seen in athletes.
Mm-hmm.
Then there's sinus tachycardia, which is a fast heart rate,
Right.
a normal response to things like exercise or stress,
Right.
but could also signal an underlying issue.
So context is key.
Yeah,
A slow heart rate in a marathon runner might be a sign of fitness,
right.
but in someone else, it could be a problem.
Exactly. It's all about the individual and their overall health picture.
Hmm.
Now, there's also a condition called supraventricular tachycardia, or SVT, where the heart suddenly starts racing, often reaching 150 beats per minute or more. It's like a car engine revving way too high.
Okay, that one definitely sounds like a cause for concern.
Yes.
What about those premature atrial contractions or paxis?
Right.
Are those something to worry about?
They can be. Remember that heart skip a beat feeling we talked about?
Yeah.
That's often a prac.
Okay.
Common triggers are caffeine, nicotine, and stress.
So that extra cup of coffee might not be doing you any favors.
Perhaps not.
Yeah.
The key is to pay attention to patterns. If you feel those flutters happening regularly or in certain patterns like pairs or runs,
Mm-hmm.
it's worth getting checked out.
Okay, we've covered a lot of ground with atrial arrhythmias, from those harmless flutters to more serious conditions.
Right.
But what about atrial flutter? Is that different from atrial fibrillation?
That's a great question. They both involve the atria, but there's a key difference. In atrial flutter, the atria contract rapidly,
Yeah.
but in a regular pattern,
Okay.
kind of like a hummingbird's wings, flapping super fast but consistently.
I like that analogy. But with atrial fibrillation, it's more chaotic, right?
Exactly. The atria just quiver instead of contracting effectively.
And our source had an interesting riddle about this.
Okay.
If the atria are quivering and the ventricular rate is irregular, what happens to the pulse?
The pulse also becomes irregular, often feeling weak and uneven.
And as we mentioned earlier, this can lead to blood clots forming in the atria, potentially causing a stroke.
Right, which is why managing atrial fibrillation is so important.
Right.
It often involves medications to control heart rate and rhythm, and sometimes even procedures like cardioversion to restore a normal rhythm.
That makes sense. So we've explored the world of atrial arrhythmias.
Yeah.
But what about those that involve the communication between the atria and ventricles?
Yes, those are called atrioventricular arrhythmias, and they can be quite disruptive.
Well, let's dive into those next then. I'm curious to see what happens when the communication lines get a little fuzzy.
Okay, so with atrioventricular arrhythmias, we're essentially talking about disruptions in the electrical signals between the atria and the ventricles.
It's like the heart's communication system is experiencing some technical difficulties.
Yeah.
And I remember from our nursing textbook that a prime example of this is heart block.
Exactly. Heart block is essentially a delay or blockage
Okay.
of the electrical impulses as they travel from the atria to the ventricles.
Mm-hmm.
It's like a traffic jam in the heart's electrical system.
And there are different degrees of severity, right? Like some traffic jams are worse than others.
That's a great analogy. There are 3 types. First, second, and third degree heart block.
Okay.
First degree is like a minor delay. The impulse slows down but still gets through.
Right.
Second degree is where some impulses are blocked completely, kind of like
Right.
a road closure, forcing some cars to take a detour.
Okay.
And then there's third degree.
That sounds serious.
It is. In third degree heart block, all impulses from the atria are blocked at the AV node. The atria and ventricles are essentially beating independently of each other. It's like the communication lines are completely down.
So what happens then?
Well, the ventricles have their own backup pacemaker.
Okay.
But it's much slower. The heart rate can become dangerously slow,
Mm-hmm.
often too slow to maintain adequate blood flow.
So it's like the backup generator kicks in, but it can't quite keep up with the demand.
Exactly. In most cases of third degree heart block, a pacemaker is needed
Right.
to ensure the heart beats at a safe and consistent rate.
Okay, that makes sense. It's fascinating how the heart can adapt, but sometimes it needs a little help.
Yeah.
Now, I know we've talked about a lot of different types of arrhythmias, but are there any that are particularly dangerous?
That's a really important question. And yes, there are some that require immediate medical attention.
Okay.
Ventricular arrhythmias, which originate in the ventricles, the heart's main pumping chambers, are the ones to be most concerned about.
Okay, so these are originating from the powerhouse of the heart. That sounds like it could cause some serious problems.
It can. Remember those premature contractions we talked about earlier?
Yeah,
Well, they can also happen in the ventricles.
right?
They're called premature ventricular contractions, or PVCs.
So it's like those extra beats, but happening in the ventricles instead of the atria.
Exactly. Some people describe them as a fluttering or skipped beat in their chest.
Okay.
And while an occasional PVC might be harmless,
Right.
frequent ones, especially those occurring in certain patterns, can be a sign of underlying heart damage or irritability. Our nursing textbook actually uses the word fluttering to describe the sensation.
It's interesting how those seemingly small irregularities can sometimes be a sign of something better.
Absolutely. And then there's ventricular tachycardia, or VT.
Okay.
This is a very serious arrhythmia where the ventricles beat extremely fast, often over 150 beats per minute.
It's like the heart is going into overdrive, but not in a good way.
Exactly. The rapid heartbeat can cause a drop in blood pressure, leading to dizziness, lightheadedness, even loss of consciousness.
And I remember reading that this one can be life-threatening.
Yes, VT can sometimes end on its own, but it often requires aggressive treatment,
Okay.
like medications or even a procedure called cardioversion,
Right.
which uses a controlled electrical shock to reset the heart to a normal rhythm.
So it's a much more serious situation than some of the other arrhythmias we've discussed.
It is.
And I have a feeling ventricular fibrillation, or VF, is even more serious.
Unfortunately, yes.
Yeah.
Ventricular fibrillation is the most serious type of arrhythmia. Our nursing textbook describes it as the rhythm of a dying heart, and that's not an exaggeration.
Wow, that's pretty intense. What exactly happens during VF?
In VF, the ventricles quiver chaotically instead of contracting effectively. It's like the heart's electrical system has gone haywire.
So basically, the heart's main pumping chambers just stop working.
Essentially, yes.
Yeah.
And without immediate intervention, VF is fatal.
Oh, wow.
The only effective treatment is CPR and defibrillation.
Right, defibrillation, that's where they use those paddles to deliver an electric shock to the chest.
Exactly. The goal is to reset the heart's electrical system,
Mhm.
giving it a chance to regain a normal rhythm.
Okay, so we've covered a lot of ground here. We've learned about different types of arrhythmias, from those harmless flutters to the life-threatening ones. But how are these conditions actually diagnosed?
Well, that's where things get really interesting. The cornerstone of diagnosing any heart rhythm abnormality is the electrocardiogram, or EKG.
The EKG, those squiggly lines that reveal the heart's electrical activity.
Exactly. It provides a snapshot of the heart's rhythm at a particular moment in time.
Right.
It can detect a wide range of arrhythmias,
Okay.
from simple bradycardia or tachycardia
Hmm.
to more complex patterns like heart block or atrial fibrillation.
It's amazing how much information those squiggles can reveal. And I remember reading about other types of EKGs, like rhythm strips and Holter monitors.
You're right. A rhythm strip is a continuous recording of the heart's electrical activity over a short period.
Okay.
It's often used in emergency settings to quickly assess the heart's rhythm. And a Holter monitor is a portable EKG device
Uh-huh.
that a person wears for 24 hours or longer,
Right.
allowing for continuous monitoring throughout daily activities.
So it's like having a 247 bodyguard for your heart, keeping an eye on things.
Exactly. It's particularly useful for detecting intermittent arrhythmias that might not show up on a standard EKG.
And I know our nursing textbook also mentioned a more invasive procedure called an electrophysiology study, or EPS.
Yes, EPS is a more specialized test used to diagnose
Right.
and sometimes treat complex arrhythmias. It involves threading thin catheters into the heart to record electrical activity and even stimulate the heart to try and reproduce the arrhythmia.
So they're going right to the source of the problem.
Exactly. It's a very valuable tool for pinpointing the location and mechanism of the arrhythmia, which is crucial for guiding treatment.
That makes sense. So we've talked about how arrhythmias are diagnosed. What about treatment?
Okay.
What are some of the options available?
Well, the treatment depends on the type of arrhythmia, its severity, the underlying cause, and the patient's overall health. But there are several main approaches: medications, cardioversion, defibrillation, pacemakers, and a procedure called radiofrequency catheter ablation.
Okay, let's unpack those. First up, medications. I know there are a bunch of drugs out there for managing heart rhythm problems.
Right.
What are those like?
Antiarrhythmic drugs work in a variety of ways. Some slow down the heart rate, others block abnormal electrical signals, and still others help to stabilize the heart's electrical system.
Okay.
It really depends on the specific type of arrhythmia and the individual patient.
So it's a tailored approach to treatment, just like we were talking about with pacemakers.
Exactly. And speaking of pacemakers,
Yeah.
those are a common treatment for bradyarrhythmias, slow heart rhythms that can cause a whole host of symptoms like fatigue and dizziness.
It's amazing how technology can step in and help the heart maintain a healthy rhythm.
It really is.
Mhm.
And then we have cardioversion, which we touched on earlier when talking about ventricular tachycardia.
Mm-hmm.
It's a procedure that uses a controlled electrical shock to convert an abnormal heart rhythm back to a normal sinus rhythm.
So it's like a reset button for the heart. Is that the same as defibrillation?
Similar equipment is used, but there's a key difference. In cardioversion, the electrical shock is carefully timed to coincide with a specific point in the heart's electrical cycle. This synchronization is important
Right.
to avoid delivering the shock during a vulnerable period, which could trigger a more dangerous arrhythmia.
So it's a much more controlled procedure than defibrillation, which is used in those life or death situations.
Exactly. Defibrillation is a much more powerful, unsynchronized shock
Right.
used for life-threatening arrhythmias like ventricular fibrillation.
Okay, that makes sense. And what about radiofrequency catheter ablation? I remember that one being mentioned in the nursing textbook.
Ah, yes, RF ablation. This is a minimally invasive procedure that uses heat to destroy small areas of heart tissue that are causing the arrhythmia.
It's like a precision strike against the rogue electrical signals.
A perfect analogy.
Yeah.
It's a very effective treatment for many types of arrhythmias.
Wow.
And is often considered a curative treatment, meaning it can potentially eliminate the arrhythmia altogether.
Wow, that's incredible. So we've explored a range of treatments, from medications to more advanced procedures.
Yeah,
It's amazing how far medical technology has come in managing these conditions.
it is.
But what about the human side of things? What role does nursing play in caring for patients with arrhythmias?
That's a great question.
Yeah.
And it's something our nursing textbook emphasizes.
Right?
Nurses play a crucial role in educating patients and their families
Hmm.
about arrhythmias and how to manage them effectively.
So it's about empowering patients to take charge of their own heart health.
Absolutely. Nurses are there every step of the way,
Right.
providing support, answering questions, and helping patients navigate the often complex world of cardiac care.
It's like having a knowledgeable and compassionate guide on your heart health journey. And speaking of journeys,
Yeah.
we've covered a lot of ground in this deep dive into arrhythmias. What are some of the key takeaways you'd like our listener to remember?
I think one of the most important things to remember is that not all arrhythmias are created equal. Some are harmless,
Right.
while others can be life-threatening. It's important to be aware of the potential signs and symptoms
Mm,
and to seek medical attention if you experience anything unusual or concerning.
that's great advice. And I think it's also important to remember that even though these conditions can be serious, there are effective treatments available.
Absolutely.
Yeah.
And knowledge is power. The more you understand about your heart health,
Right.
the better equipped you are to advocate for yourself and make informed decisions about your care.
Well said. And I have to say, learning about all of this has given me a newfound appreciation for the complexity and resilience of the heart.
Me too.
Yeah,
It truly is a marvel of nature.
it really is. Now, I'd love to leave our listener with a final thought-provoking question based on what we've learned today. Knowing that even seemingly minor things like caffeine or stress can contribute to arrhythmias, what small changes might you consider to support your heart health?
That's a great question to ponder. And while we've covered a lot today, remember this is just a starting point. If you have concerns about your heart rhythm, it's always best to consult with a healthcare professional.
Excellent advice. Well, we've explored a lot in this deep dive into heart rhythms, but as you said, it's just the beginning. There's always more to learn.
Exactly. And that's the beauty of it all.
Absolutely. So on that note, we'll wrap up this episode of The Deep Dive. A huge thank you to our brilliant expert for guiding us through this fascinating topic. And to our listener, thank you for joining us on this journey of discovery. Until next time, stay curious and keep those hearts beating strong. You know, it's one thing to understand the science behind arrhythmias, but it's another to think about what it's like to actually live with one of these conditions. It can be a lot to navigate.
Absolutely. And that's where nurses really shine, I think. They play such a vital role
Yeah.
in supporting patients,
Mhm.
especially when it comes to something as complex as arrhythmia management.
Our nursing textbook really highlights that, doesn't it? It talks
Yeah.
about how nurses are key in educating patients and their families
Yes.
about these conditions, empowering them to take an active role in their own care.
It's not just about treating the arrhythmia itself. It's about giving patients the knowledge and the tools to manage their condition long term.
It's like giving them a roadmap for their heart health journey. What kind of things do nurses focus on when it comes to patient education?
Well, it really depends on the specific type of arrhythmia and the individual patient's needs.
Mhm.
But some common topics include medications, lifestyle modifications, recognizing warning signs, and knowing when to seek medical attention.
So it's about helping patients understand the why behind the treatment plan.
Exactly. For instance, let's say a patient has a pacemaker.
Okay.
Nurses would explain how the device works, how to care for it, what activities to avoid, and how to monitor their pulse.
So it's not just about the technology, it's about helping patients integrate that technology into their lives.
That's a great way to put it. And think about lifestyle modifications, like
Yeah.
something as simple as reducing caffeine intake can make a big difference for some people.
Right, and stress management is huge, isn't it? We talked earlier about how stress can be a trigger for certain arrhythmias.
Absolutely. Nurses can provide guidance on stress reduction techniques,
Mm.
like deep breathing exercises or mindfulness practices. They're also there to answer questions, address concerns, and provide emotional support.
It's like having a cheerleader in your corner, rooting for your heart health.
I love that analogy. Nurses are incredible advocates for their patients.
They really are. Well, I think we've pretty much covered everything in our nursing textbook and then some.
We have.
This has been such a fascinating deep dive into the world of heart rhythms.
It really has. We've explored a lot, haven't we?
Yeah.
From the intricate workings of the heart's electrical system to the diverse range of arrhythmias and the many ways they can be managed.
And I have to say, I'm walking away with a newfound respect for this incredible organ. It's amazing how much it does for us every second of every day, often without us even realizing it.
It's a true marvel of nature.
It is. So before we wrap up, I'd love to leave our listener with one final thought. We've talked about how even small things, like that extra cup of coffee, can affect our heart rhythm. Knowing that, what's one small change you might consider making to support your own heart health?
That's a great question to reflect on. And remember, while this deep dive has given us a lot to think about, it's just the beginning. If you have concerns about your heart rhythm, the best thing you can do is talk to your healthcare provider. They can help assess your individual situation and recommend the best course of action.
Such wise words. Well, on that note, we'll bring this episode of the Deep Dive to a close. A huge thank you to our expert for sharing their incredible knowledge and insights. And to our listener, thank you for joining us on this journey of discovery. Until next time, stay curious, stay informed, and keep those hearts beating strong.